If you are over 50 and living with diabetes, one small fruit choice can quietly raise your blood sugar within minutes. Many seniors stop eating fruit out of fear, while others eat the wrong ones believing they are healthy. Doctors often say this confusion does more harm than good. Aging bodies still need fruit, but only the right kinds in the right way. Blood sugar does not have to feel like a daily gamble. With clear guidance, simple fruit choices can help protect energy, nerves, and long-term health instead of threatening them after 50 for many families today everywhere. Now, if this information matters to you or someone you love over 50, stay connected here. Subscribe now so these simple protective food truths reach you before confusion causes harm. Like this video to support senior health education and comment below so concerns are heard and answered with care and respect. Item 1. Berries, blueberries, strawberries, and raspberries. Berries like blueberries, strawberries, and raspberries are among the safest fruits for people over 50 living with diabetes. Some doctors explain that these fruits contain less natural sugar than many others while offering strong protection for aging bodies. Their low glycemic impact means blood sugar rises slowly instead of spiking suddenly after eating. This slower rise is important because sharp spikes strain the pancreas, blood vessels, and nerves, especially later in life. Berries are rich in fiber, which helps slow digestion and reduces how quickly sugar enters the bloodstream. Research often links higher fiber intake with better blood sugar control in older adults with diabetes. Fiber also supports gut health, which doctors now recognize as closely connected to insulin sensitivity. Another reason berries matter is their high antioxidant content, including compounds called anthocyanins. Some studies suggest these antioxidants help reduce inflammation and protect blood vessels damaged by long-term high sugar. For seniors, this protection may lower the risk of complications affecting the eyes, kidneys, and nerves. Blueberries are often highlighted by nutrition experts because they provide strong benefits with relatively small portions. Strawberries and raspberries are also excellent choices, offering fiber and vitamin C with minimal sugar impact. Fresh berries are ideal, but frozen berries without added sugar remain a healthy and practical option. Doctors often note that freezing preserves most nutrients, making frozen berries useful year-round. Portion size still matters, even with healthy fruit, especially for seniors managing diabetes. Many experts suggest a small handful or about half a cup at one time. Eating berries earlier in the day or alongside protein may help maintain steadier blood sugar levels. Some doctors caution against eating large bowls of fruit alone, even when the fruit is healthy. Balanced intake allows berries to work as support rather than a hidden source of excess sugar. When eaten properly, berries offer seniors a way to enjoy sweetness without fear. They fit easily into meals, snacks, or simple breakfasts recommended by many diabetes educators. Over time, consistent choices like berries may support more predictable blood sugar readings. Predictability is valuable for seniors because it reduces stress and lowers the chance of sudden symptoms. Some patients report feeling steadier energy when replacing sugary snacks with small portions of berries. This steadiness can support daily activities and confidence around food choices. Berries do not cure diabetes, but they can support the body when used wisely. Doctors often encourage focusing on patterns rather than perfection when managing blood sugar after 50. Including berries regularly in controlled portions fits well into that practical approach. For many seniors, this simple fruit choice brings both nourishment and peace of mind without unnecessary blood sugar worry when guided by trusted medical advice.
Item 2. Apples with skin. Apples with the skin on are considered a safe and helpful fruit for many seniors managing diabetes when eaten the right way. Some doctors explain that apples provide a steady release of natural sugar rather than a rapid spike, which is especially important for aging bodies. The key reason apples help is their high content of soluble fiber, particularly a type called pectin, found mostly in the skin. This fiber slows digestion and delays how quickly sugar enters the bloodstream, helping blood sugar remain more stable for hours. For people over 50, this steady effect can reduce feelings of sudden hunger, shakiness, or fatigue that often follow blood sugar swings. Nutrition researchers often note that peeling an apple removes a large portion of its fiber and protective compounds, Without the skin, the sugar is absorbed more quickly, which can raise blood glucose faster. That is why many diabetes educators recommend eating apples whole with the skin intact unless there is a medical reason not to. The skin also contains antioxidants that help protect blood vessels, which are more vulnerable to damage from diabetes as people age. Protecting these vessels support heart health, eyesight, and circulation, all common concerns for seniors. Not all apples affect blood sugar the same way. Some doctors suggest choosing slightly tart varieties, such as Granny Smith or Fuji, because they tend to have a lower glycemic impact than very sweet apples. However, even sweeter apples can still be included in moderation. Portion control is essential. Many experts recommend one small apple or half of a large apple at a time for seniors with diabetes. Eating more than that may overwhelm the body's ability to manage sugar, even from a healthy source. Timing also plays a role. Apples are often better tolerated when eaten as part of a meal or paired with protein or healthy fat. This combination slows digestion further and supports steadier blood sugar. Eating an apple alone on an empty stomach may cause a faster rise in glucose for some people. Doctors frequently emphasize that individual responses can vary, so paying attention to how the body reacts is important. One critical warning often shared by medical professionals is the difference between whole apples and apple juice. Apple juice lacks fiber and delivers sugar rapidly into the bloodstream. Even unsweetened juice can cause sharp blood sugar spikes, making it a poor choice for people over 50 with diabetes. Whole apples, by contrast, provide fiber, fullness, and slower sugar absorption. Regularly choosing whole apples instead of processed snacks may support more predictable energy throughout the day. Some patients report fewer cravings and better control when apples replace sweets or refined carbohydrates. Apples are not a cure, but they can be a reliable, comforting fruit choice when eaten properly. For seniors, this balance of nourishment and blood sugar stability makes apples a valuable part of diabetes-friendly eating, guided by common medical advice.
Item 3. Avocado. Yes, it's a fruit. Avocados are a unique fruit that many seniors with diabetes overlook or misunderstand, yet some doctors consider them one of the most supportive choices for blood sugar control after 50. Unlike most fruits, avocados contain very little natural sugar and are rich in healthy fats. These fats slow digestion and help prevent sudden rises in blood glucose. Because aging bodies often struggle with insulin efficiency, foods that reduce sugar spikes become increasingly important. Avocados provide energy without placing stress on the pancreas, which is why they are frequently recommended in diabetes-friendly eating plans. Medical research often highlights that healthy fats improve insulin sensitivity, meaning the body can use insulin more effectively. This matters greatly for seniors, as insulin resistance tends to increase with age. Avocados contain monounsaturated fats, the same type often praised for heart health. Heart disease risk is higher in people with diabetes, especially after 50, so foods that support both blood sugar and cardiovascular health are especially valuable. Some doctors explain that reducing inflammation through diet may also help stabilize blood sugar over time, and avocados are known for their anti-inflammatory properties. Another benefit of avocados is their fiber content. Fiber slows the absorption of carbohydrates and supports more stable blood glucose levels. Even though avocados are low in carbohydrates, the fiber they contain adds an extra layer of protection. This combination of healthy fat and fiber makes avocados filling, which can reduce overeating and unnecessary snacking. Feeling satisfied is important for seniors who may struggle with appetite changes or blood sugar swings that lead to cravings. Portion size still matters, even with a healthy fruit like avocado. Many nutrition experts recommend about 1/4 to 1/2 of a medium avocado at a time for people with diabetes. Eating too much at once can add excess calories, which may affect weight and insulin sensitivity over time. Moderation allows the benefits without unintended drawbacks. Doctors often stress that more is not always better, even when a food is considered healthy. How avocados are eaten also matters. Seniors are often advised to consume them as part of meals rather than alone. Combining avocado with vegetables, lean protein, or whole foods helps maintain balanced digestion and steadier blood sugar. Eating large amounts of avocado on its own may cause digestive discomfort for some people, especially those with sensitive stomachs. Paying attention to how the body responds helps guide proper intake. A common mistake is assuming that all avocado-based foods are equally healthy. Processed products with added sugars, refined oils, or excessive salt may reduce benefits. Whole, fresh avocado is the form most doctors recommend. When used wisely, avocados offer seniors a rare fruit option that supports blood sugar control instead of challenging it. They do not replace medical treatment, but they can be a powerful addition to daily eating patterns. For many people over 50, avocados provide steady energy, fullness, and reassurance that fruit can still be enjoyed safely with diabetes when guided by sound medical understanding.